Hi, this is Brian Kim. I'm going to share with you this SimulEYE model small pupil case that I'm going to show using the Malyugin ring. And so you've seen on my videos, I really use the Malyugin ring and pupil expanding devices on certain select cases, namely cases where there's a dense cataract and zonulopathy. But there is a systematic way that I like to approach the Malyugin ring, and I feel like the way I do it is fairly efficient, and it's also pretty safe with minimal risk for trauma the way I do it. So this is my surgical tray with my instruments. This is the surface coating gel, which you can coat on the surface of the cornea. And this is the viscoelastic substitute. Again, none of this is supposed to be used for real patients. This is just for the models. And this is a 3mm metal blade, as well as a 15-degree blade for my paracentesis incision. And so I'm using these blades instead of my diamonds, since I'm going to be doing it on a model here. And this is the small pupil model eye here. This is a Malyugin ring injector. And these are rings that we used on patients and then cleaned them and saved them. And so you can see that they're floating around in that solution. And so, the Malyugin ring is quite expensive, and so I decided to use these used rings. We'll see how they will hold up when we use the device. So I'm taking the small pupil model out of the box. And so that's the model. I've already taped the plate to my microscope bed, the head of the bed, with some surgical tape here. And so the model actually has a suction cup, so you can just push down on the suction cup. What I didn't realize here is you see those red marks. Those red marks are really for your incision. And so this is my setup with the microscope, the plate taped to the head of the surgical bed, as well as the model. I oriented the hash mark so that's towards me, as you see here. And so this is for my paracentesis incision. This is the 15-degree blade. And again, I like to use these disposable blades instead of my diamond blades on these models, just so that I don't damage the blade. So this is the stab incision, and then I'm going to make my main incision with the 3mm metal blade. And obviously it feels different from when you're doing real surgery. The plastic just feels quite different. And this is the viscoelastic substitute. Rather than going through the paracentesis, it's just easier to go through the main incision. It's like an 18 gauge cannula, is pretty big. And so this is a Malyugin. I took it out of the container. And I'm sorry it's not on the screen there, but I'm going to try to load it and get it into the Malyugin injector. Trying to get that one eyelet, the left eyelet, protrudes up, so I have to push it down, and then it goes in. So I like to do this with a Lester in my left hand and then the injector in my right hand. I like to hold the injector like a pencil and then use my pointer finger to slide the slider forward to deliver the ring. And so that's the nice thing about the ring, is you have really exquisite control using the slider with your pointer finger. So I lift the incision with the Lester, go in because it does have a little bit of thickness to the injector. And then I'm going to go in with my paracentesis incision. So as you can see here, even though I made a nice incision, it's not really going in. And so I have to go back and widen the incision. And again, this is made of plastic. So just be generous and make a nice incision so you don't struggle with that. So I lift the incision, place the injector in, place the Lester in. You want to make sure the Lester is pointing straight up and down. As I'm sliding the slider forward, you can see the first eyelet is coming out. You want to place the iris so that it goes right between the scroll. And as you're pushing and advancing the slider, the side scrolls come out. And so the key is to make sure you orient the side scrolls in such a way that the iris is captured between the top and the bottom scroll on each side. And if it doesn't happen properly, you can rotate your wrist a little bit, but you can also use your second instrument to help you. So in this case, I'm wondering, maybe I have the ring upside down because the right side scroll just doesn't want to engage the iris here. That scroll should be going underneath, and it's not really doing that. And so I decide to start over. So I take it out, and then I flip it over. There we go. And then I have the slider pushed all the way forward so that little hook engages the scroll, and then I was able to capture that scroll, and I'm pushing the device back in, using the Lester to push that left side scroll, and it goes in now. So this is the thing about these models. Every time you go in and out, it introduces air. And so the main thing, anytime you go in and out of the model eye, you have to actually push some more viscoelastic. So I go ahead and come out, push some more viscoelastic, and fill up the anterior chamber. And this is something you'll see me forget to do, and you have to just keep going back and putting more viscoelastic in every time you come out. So again, I have my Lester advancing the device, making sure the scroll, yeah, that's right. You see I'm showing going up and above it and below it. You just want to make sure the iris is between the two scrolls. Once it's engaged, you want to deliver the device by sliding the device forward, and then it engages the scrolls on the left and right side. And then as you're pushing the slider all the way out, the hook should really release upward off of the last scroll, and then I'm using the Lester to deposit the subincisional scroll into proper position. So by using the Lester, you have a lot of control with placing that last scroll into place. This is how I like to place the Malyugin ring. So now we're going to go ahead and disengage the ring, assuming we're done with the case. Lifting the incision or pushing down the incision, placing the injector in. I'm going to disengage that subincisional scroll with the Lester. See, I'm making sure that I have both scrolls on top of the injector platform here. That's the key for this. So it's both are on top of the platform. I push the slider forward, the hook comes up, making sure the Lester's holding the scrolls. And as I pull the slider back, it hooks the scroll, and then it starts to pull the device into the chamber. Normally at this point, you can just pull the entire device out, but you can see with this fake eye, it doesn't quite work that way. And so I'm going to push the left side scroll down with the Lester, and it slides right in. So I decided to switch the scrolls here because, as I said, this is a used ring, and so each scroll may be different. So I switched to different scrolls just to see how this ring will work. So I'm trying to push down with the Lester so that left side scroll goes in. Push some more viscoelastic first. Gaping the incision with the Lester, going in with the injector. Go ahead and advance the ring by pushing the slider forward, making sure that the iris is between the top and bottom scroll here, which it does. As you push the slider forward, you can see the side scrolls come out and expand. As they expand, you want to direct the scrolls in such a way that the top and bottom scroll will flank the iris. See, the right side didn't quite engage, so you can always just place it in with the Lester. And you have to keep pushing the slider forward in order to really cause the two scrolls to spread out, which engages the iris. So that's what you'll see here. I'm pushing, it engages the iris. And then I'm going to hook the last scroll with the Lester, making sure I pronate my hand, making sure it's disengaged, and then repositing the subincisional scroll onto the pupil. You see the right side scroll disengaged, then I just place it back in to capture the iris. Obviously, this model doesn't quite work the same as a real pupil. And again, this is a used Malyugin ring, so there might be issues with using a used ring. So go ahead and lift the subincisional scroll up, holding it with the Lester, pushing the plunger forward so the hook is raised. and then capturing it and sliding it back down to hook it. You keep pushing the slider backward to engage the ring so it goes into the chamber, and a push down with the Lester on the left scroll and it comes out. So I'm just trying this with different scrolls, and I'll be switching to a different ring at some point. So the key again is the beauty of the Malyugin ring is such a low profile, and so it's really not cumbersome. It's not in the way. It's not in danger of hitting the cornea, and so it's really a nice device in that regard. And the key is just to be able to engage the top and bottom scroll so that it captures the pupil edge. So here we go. We're just advancing the slider, making sure the iris is captured between the two scrolls. And I'm just pulling it back and forth just to simply illustrate that you have exquisite control over the ring with the slider. The slider is really the key, and if you don't feel comfortable, just go ahead and pull the ring back into the shaft of the injector. Once the leading edge is engaged, you can continue to deliver the side scrolls, and you're just gently pushing the slider forward. If you feel good about the position of your scrolls on each side, then keep going. If not, you can always pull it back. So in this case, it engaged the side scrolls. I was able to hook the last scroll with the Lester, and then I was able to disengage the scroll from the injector and then get around it and then reposit the last scroll sub-incisionally. So I'm doing the same thing here. I'm going to go ahead and disengage the last scroll, lifting it up, making sure my wrist is pronated so I can hook the Lester and the ring appropriately, advancing the slider so that the hook comes out. And before I pull backward, make sure that the ring is engaged properly, and then it gets pulled in with the hook. As I'm sliding the slider back, the device collapses into the shaft, and then I'm just pulling it back out. Again, just to illustrate, what are the potential things that can occur? The scroll can go under, as you can see on the left side. If that happens, just pull backward and let the device collapse into the shaft again, and then you can start over. As you push the slider forward, it causes the side scrolls to be expanded laterally on either side, and it captures the pupil edge really nicely there. And then you can see I use a Lester to hook that last sub-incisional scroll, and then you can place it and deposit it into place. Pushing some more viscoelastic, and so at this point I'm getting really the hang of doing this with this artificial eye here. So pulling the scroll up, pronating my hand to make sure that I have it with the Lester. Oh, it slipped. So I have to pronate my hand even more here. There you go. Making sure the ring is on top of the platform of the injector. The device collapses into the shaft, pushing down on the left ring with the Lester. The whole thing collapses into the shaft. So this is another technique that I use. Go ahead and disengage the last scroll with the Lester. But when you try to pull it out, because some people have talked about that, when you pull it out, it gets stuck on the incision. You could use forceps as well, but the issue that I have with this technique, it's not as controlled, and sometimes the scroll gets snagged on the pupil. So if you yank on it, you can actually pull on the iris and damage the iris root and get a hyphema. And so I don't like yanking devices off the iris, and so I like to use a two-handed technique, so I gently disengage the pupil from the scroll. So in this case, it's disengaged already. I have both instruments in the eye. I lift the scroll with the Lester, pronating my hand, advancing the slider so that the hook is up. Once I have it in position, I pull it back. It engages the scroll, and the device collapses into the shaft, and you're able to pull it out atraumatically. And as I'm pulling that last scroll off, I want to make sure that the iris is not caught in the scroll. If it is, then I use a Lester to just tease it off of the scroll, and that's the key. You just have to watch it. You don't just yank the whole thing out, because if you rip the whole iris root, then now you've done more harm than good. So go ahead and advance it again in a similar manner, making sure the leading and then the side scrolls are in position, again being controlled with a slider, and then repositing that final scroll in place with the Lester. Lifting that scroll again with the Lester, pronating my hand so it's caught, advancing the slider so that it hooks on the last scroll, pulling it back, causing the device to collapse into the shaft of the injector, and then we're able to come out. So now we're going to try this surface coating. I didn't use this surface coating yet. I had a really good view with my eye, but it's probably because it's brand new. I take it if you have it multiple uses, maybe it'll affect your view. Let's go ahead and place the coating on the cornea now. So I put a little bit, and obviously it's not enough, so I'm going to go ahead and put some more. And I'm just using the cannula to kind of paint it. It's got kind of a high surface tension, so it's kind of just balling up in the middle there. So I'm just pushing some more on the periphery, making sure I get a nice peripheral coating of the coating solution or gel there. Let's go ahead and place the ring now, see if the visualization is any better. Gape the incision, place the injector in, placing the Lester in. Advancing the device, pushing the slider forward, engaging the device on the pupil with the scroll on the top and the bottom of the pupil, pushing forward, which causes the side scrolls to come out nicely, engaging the pupil with each side scroll, lifting the last scroll up with the Lester and depositing the hook into the pupil. Using the Lester to grab the scroll up, pronating my hand, repositing it into the device, the injector, sliding the hook back to engage the last scroll. The device collapses into the injector, making sure both scrolls go into the shaft of the injector and you pull it out. So I go ahead and again, without putting viscoelastic, you can see that bubble forms again. So I'm going to go ahead and put some more viscoelastic in. And this will be my final attempt. So I go ahead, deliver the leading scroll, engaging the scrolls on the pupil edge. As I advance the slider forward, both side scrolls come out. I want to be mindful that the scrolls engage the pupil edge here. If it's not, I can always pull the slider back. In this case, it engages it nicely. Continue to advance it, which maximizes the engagement, pushing the slider all the way forward so the hook comes up, grasping the last scroll with the Lester, holding it by pronating my hand, and then repositing the scroll into place. Okay, now we're done with the surgery. Go ahead and lift that last scroll up, pronating my hand so the scroll is up, pushing the slider all the way forward so the hook is all the way up, repositing the last scroll on the platform of the injector, hooking the scroll, pulling it down. It collapses into the shaft of the injector. I'm pushing down with the Lester so that scroll goes into the injector as well, and then I come out. So these are my tips on how I'm able to place the Malyugin ring with a two-handed technique in the most atraumatic way that I know. Make sure the scrolls engage the pupillary edge, first the leading and then the side scrolls. You have exquisite control over how the scroll goes out. If you don't feel like it's engaging the pupil, you can just pull the slider back and the side scrolls will collapse and you can just start again. I think if you do it that way and you're having control with the injector, you can really engage the pupil edge with the scrolls on the first shot rather than having to manipulate it after the fact. So try to do it all in one shot, and then using the Lester, you can take the trailing or the last scroll up out of the injector, and then while you're pronating that left hand, you can reposit that last scroll into place. And when you remove it, you can again use the Lester to lift that last scroll up, pronating your hand so it holds it nicely, and then sliding that slider all the way forward so the hook is up. Place the last scroll on top of the platform of the injector, pull the slider back, which causes the hook to come down and engage that last scroll. Pull it all the way back, it starts to collapse the side scrolls, Be mindful that the side scrolls are not holding the pupil, which can cause problems. You can use a luster to disengage the pupil from the scroll. And then as the side scrolls collapse into the shaft, when you're pulling down, you want to make sure that last scroll, the contra-incisional scroll, that leading scroll, is disengaged from the pupillar edge so you don't cause any damage to the iris. So I hope this was helpful to you, and I thank you for your attention.